Citizens of the world, the Dutch government's strategy to fight the COVID-19 outbreak is based on group immunity. They want to control the spread of COVID-19 amongst the healthy and strong citizens with weak social distancing measures. They say this will eventually cause group immunity. Last Friday, the Dutch government took some light measures to fight the outbreak. On Sunday, they increased those measures by also closing schools, sex clubs, coffee shops, restaurants, and cafes. Regular shops, like clothing shops, remain open, which causes Belgians and Germans to cross the border and do some casual shopping in the Netherlands. The Dutch government only wants to take action when it's needed. They are monitoring the situation on a day-to-day basis, which means that they will always be 1 or 2 weeks behind when it comes to containing this virus. There is no aggressive testing, and housemates of confirmed COVID-19 patients are still allowed to leave the house. The government does not want to go in full lockdown yet, but they are not excluding the option. They first want to try out their group immunity plan by increasing the social distancing measures when needed. They are convinced that our medical system is prepared and up for the task. They ignore warnings from Italy not to underestimate the virus. And they also ignore advice from the World Health Organization saying that a plan based on group immunity is a bad thing, especially because it is not yet proven that people who recover from COVID-19 are actually immune. And what happens when the virus mutates and reinfects everyone that has previously recovered? This plan also needs a vaccine to succeed, but developing a vaccine takes a really long time. It has already been said that it will take about a year, maybe even a year and a half, before a vaccine is ready, and this would be a record time. This plan really sucks if you ask me. Reports are already coming out that we will have 1,000 coronavirus patients in intensive care somewhere next week. This is highly concerning because we only have 575 intensive care units at this moment. Experts say we can increase the total intensive care units to 1,500 during a crisis, but we need an additional 500 respirators, which have yet to be found. So my guess is that the plan the Dutch government is currently executing will fail, and our health system might collapse because of it. Only when this happens, the Dutch government will take action and go into full lockdown. Controlling this virus is probably only possible with a full lockdown, so why wait until the situation gets out of control? A full lockdown is needed to prevent this horrible situation, and it's needed now. By going into full lockdown, we give our healthcare system the much-needed time to prepare. We can increase the maximum capacity of intensive care units easier, we drastically decrease the total number of daily infections, and we can extinguish the virus by going in lockdown long enough. Another reason to go into full lockdown is that we can learn more about the virus while we are under lockdown, and eventually loosen the restrictions when we have better knowledge about this virus. On March 18, during a live coronavirus debate, Dutch Minister of Healthcare Bruno Bruins collapsed due to exhaustion. On March 19, he suddenly resigned from the Dutch cabinet. Hugo de Jonge will replace him.
Dank u wel, mevrouw de voorzitter. Mevrouw de voorzitter, vorige week donderdag, vrijdagochtend is een motie van collega Asscher en ondergetekende aangenomen die zegt dat de IC-capaciteit, inclusief alles wat erbij hoort natuurlijk, de mensen, de apparaten, de beademingsapparatuur, dat die minister alles moet doen om te zorgen dat er voldoende is. Mijn vraag aan hem is, weet hij hoeveel is voldoende? Dat is mijn eerste vraag. Mijn tweede vraag is...
Wacht even, ik schors de vergadering. Uit de buurt. Even.
A new study concludes the coronavirus can float in the air and remain contagious for several hours after a cough or a sneeze. On March 17, a study was published on the New England Journal of Medicine stating that the coronavirus can stay airborne for at least 3 hours. And to be clear, this study has already been peer-reviewed. The research team found that it takes about 66 minutes for half the virus particles to lose function if they are in an aerosol droplet. That means that after another hour and 6 minutes, 3/4 of the virus particles will be essentially inactivated, but 25% will still be viable. The amount of viable virus at the end of the third hour will be down to 12.5% according to the research. So after 3 hours, 12.5% of the droplets that are aerosolized are still contagious. This is a huge finding. This confirms my statements in previous videos about the virus being airborne. And why is this important information for the public? Well, let's just say that an infected person goes to a grocery store. He coughs, scrapes his throat, sneezes, or maybe even just by breathing, he releases virus particles into the air. Some of these particles are too big to stay airborne and will fall down on surfaces pretty quickly. But some of these particles are small enough to become aerosolized. If the grocery store is poorly ventilated, chances are that these virus particles remain in the air and stay contagious for a rather long time. After 3 hours, most of the particles lose their contagiousness, but 12.5% will remain contagious. So basically this means that when you walk into a room, enter a closed car, walk into a shop with closed doors or windows or anything where it's not ventilated that great, where an infected person has recently been, you have a chance of breathing in aerosolized virus particles. And this is why protective masks with P3 filters actually do protect the public from infection and not just medical personnel. The study also claims that on stainless steel and plastic, viable virus could still be detected after 3 days. On cardboard, the virus was not viable after 24 hours. On copper, it took 4 hours for the virus to become inactivated. The study ends with the following statement. Our results indicate that aerosol and fomite transmission of SARS-CoV-2 is plausible, since the virus can remain viable and infectious in aerosol for hours and on surfaces up to days, depending on the inoculum shed. These findings echo those with SARS-CoV-1, in which these forms of transmission were associated with nosocomial spread and superspreading events, and they provide information for pandemic mitigation efforts. Reporting to you from Amsterdam, give this video a thumbs up, subscribe to the channel, stay safe, and see you next time.